Welcome back. The opioid crisis shows no signs of slowing down, and first responders continue to be overwhelmed by the massive increase in overdose calls. Naloxone kits have become a lifeline, but they aren't always easy to obtain. One local company is aiming to fix that by making the nasal spray version available online. Joining us now is their president, Vern Bickham of Iridium Medical. Thanks for joining us, Vern.
Thanks for having me. It's great to be here.
Tell us a little bit about why you decided to push this and offer this online.
Well, Jay, the simple answer is that, we're a member of the community like everyone else here is, and we hear the stories on an ongoing basis about people that are dying. There were about 1,000 people that died last year. And our company exists to enable peace of mind to people that respond to medical emergencies. So the stories that we hear in the news, my personal, couple of anecdotal stories that I heard, going to a client meeting and hearing of a gentleman who has a 25-year-old son who lost three friends this year. Another story where there was a young person who was a nephew of somebody connected to us, a UBC graduate student that passed. And for us, these stories really sort of resonate with us. Given that we're here to help with people that respond to medical emergencies, we were compelled to do something. So we started and we looked at the kits and sent one of our team members to go to a local pharmacy to get the kits that were advertised as being available, and was very surprised to hear that he was raked over the coals, asked a series of questions, and to the point that he texted me and said, I'm really uncomfortable. Can I come back to the office? I said, absolutely. And so we thought, wow, that's a bit of a barrier to somebody that might be trying to be proactively getting in front of something. And then secondly, after that, we looked into what was inside the kits, and we noticed they're all needle-based intramuscular delivery. And our argument is that the vast majority of people, even those that deliver needle injections on a regular basis, are probably more comfortable delivering a nasal-based administration. So we decided to put them online and nasal, eliminating an access issue potentially, as well as a comfort issue.
So in a nutshell, this is offering an easier alternative to fix a very serious problem that, as we said, shows no signs of slowing down.
Yeah, this is another tool. We're not under the impression that it is a magic bullet. It is another tool in the fight, and one that I think has great merit.
You've worked directly with first responders who are on the front lines dealing with this epidemic. What's been the response to these nasal kits? Yeah,
so we're a physician-founded company. Dr. Alan Holmes is our medical director, and he is the medical director for about 50% of the fire departments in the province. He recently spoke at the BC Fire Training Officers session about naloxone, and there are a lot of early adopters within the fire departments that are using the nasal version and having great success. There was a lot of interest on the topic at the conference, and they are certainly early adopters that are using it.
Just before we get into the kit and you show us how it works, have you run into some negative feedback in terms of, if these kits are readily available, does that perpetuate the drug problem? Has that been a conversation that you've come across?
It is without a question. It is a very contentious issue. There are opinions that value life differentially and suggest that maybe selected sort of subgroups of the market, shouldn't be investing any money. And so what we've done here is by doing this is a voluntary out-of-pocket purchase. This is not tied to any taxpayer-funded program. So there's that distinction. And also, as we talk about who this is for, you'll see that it's not necessarily the users that are buying themselves. And so there's a disconnect in the sense of it's not using to endorse behavior.
All right, let's take a look here, Vern.
Great. So the goal is, of course, we wanted to try to make it not overly medical, not intimidating, so it's a kind of a simple design, and the kits inside are very simple. So we have instructions on the inside that guide you through the process. They're on the lid. They're also on the bottom of the kit in the event that you toss this aside, because it could be a very stressful moment when the time comes. There are two nasal Narcan, which is the brand name of the nasal naloxone, and gloves. These are just standard latex gloves, and you have a pocket mask. Standard pocket mask, and the instructions guide you through the process of how you would go about utilizing it. The idea is initially, of course, you want to ensure that the scene is safe when you approach, and then once you've done that, you call 911. That's always the response. You keep them on speakerphone so that they're to guide you through it. That's what they're there for. You would administer it, and I've actually brought a sample for you. This is a one-time use, Jay, so this is really special.
Okay.
So just basically put your fingers around the top.
Yeah.
Okay, like that, and then you just press the plunger.
And we should point out it's just water mist.
It is just water mist, just water mist.
So this is ready to go.
There you go. So that's it. So had you delivered that in the nostril of somebody that had suffered from overdose, you would have started the process.
Right.
That mist gets absorbed by the nasal mucosa, gets into the bloodstream, and it starts to act right away.
Now, is this just as effective as the injection kit?
It is every bit as effective. So we have a lot of examples of the efficacy through, there's a study by the WHO, for example. There's an Australian peer-reviewed study that shows it. Obviously, the manufacturers tell you that as well. And so when we look at the market, we divide it up. We think that everybody has friends, family, and colleagues that could be at risk. You look at the stories and the types of people that are involved. And from our perspective, we view it as you could use this in the home. You could use this as a discussion piece with your family if you have a family member you're concerned about. Naloxone on the go, we also call it, and that is for putting it in your bag or putting it in your backpack if you're going to be at a place where you think people are at risk. And lastly, the public/facilities group. So we have a lot of interest from college and universities and pubs and clubs and places where you may have people within your facility that may be at risk and may be involved in some behaviors that lead to that.
Fascinating idea. Vern Bickham from Iridium Medical, thank you so much for taking the time and showing this. And yes, we'll keep in touch with you, and I'd like to know how it goes down the road.
Great. Thank you very much.
Appreciate
Really appreciate it.
All right, let's take a short break here on BC One. We'll be right back after the break.